I'm Dr. Kuang, practicing urologist for the last 20 years and the founder of Man vs. Prostate, where bladder health matters. Let's come together and help men live the version of their lives without the fear of an overactive bladder or urgency incontinence. There's so much anxiety that comes with having to figure out where all the toilets are, near the grocery store, near work, having to make sure you use the bathroom every time you go on a trip, or stopping multiple times on a road trip to go see your grandkids, or always having to break away from business meetings to use the bathroom. And then as men progress to the even more serious stage of urgency incontinence, there's so much shame. It's very emasculating. Having to wear diapers or liners, the smell of having a little bit of urine always present. It's so important that we work together to diagnose overactive bladder and urgency incontinence for all of our patients, men and women. Because remember, there's only two major organs that we cannot transplant, the brain and the bladder. Yes, it is so precious and we need to prioritize its health and function. And for far too long, we've been focused on the prostate. Yes, it's important, but we need to allow the prostate to move over so the bladder can share the red carpet and also be in the spotlight in our management of men's health. We need to recognize that 4 out of 5 men with overactive bladder are not being diagnosed. Living with overactive bladder for so many men with BPH is not acceptable. I think we need to recognize that too many men wake up and they put on this armor of masculinity and are not willing to lower their defenses and say, hey, I'm not doing okay. Too many men suffer from I'm fine syndrome, IFS. And that's where they're not really fine, they're just fearful. Now, in order to differentiate the etiologies of overactive bladder for men is really challenging. Remember, diagnostic uncertainty always exists for men. If you're using the International Prostate Symptom Score, a fantastic tool, just remember they don't have a question about incontinence. And so it's going to be important for you to add that question on top. For those of you who are willing to use a community-based tool, there is the International Bladder Prostate Symptom Score, which is basically the International Prostate Symptom Score plus the incontinence question for urgency incontinence. The American Urological Association guidelines does recommend and say, hey, look, you can use beta-3 agonists like Gemtesa as part of your management strategies for these men. For me, prescribing Gemtesa, I think it's important for all of us to consider what are the things we have to worry about. Historically, we thought about hypertension and their 24-week study looking at folks 65 years and older, looking at about 500 some patients in the Gemtesa group and the placebo group. They were able to find that the rates of hypertension were similar, 9.0% for Gemtesa and 8.3%. One word of information that I think is really important is just understanding for those patients who are also on digoxin, it's important to be monitoring those levels since it can increase serum maximum concentrations. Remember, there is hope. We now live in this age of bladder health and BPH diagnostics and therapeutics, and we have great short-term, long-term management strategies and treatment like beta-3 agonist Gemtesa, and we can work together to help men recognize that this is not just something men have to live with, leaking down their leg. There are management strategies, and that they don't have to resign themselves to that lifestyle, and that there are ways to find relief. Too many unmet needs exist for the management of overactive bladder and urgency incontinence. The first is simply to prioritize bladder health. Number 2, we need to do a better job of screening. In fact, we advocate that every community healthcare system should work together with their urology team to understand better screening practices. And finally, we need to have a better linguistic framework within which we can have dialogue with our patients and with each other. Talk to your representative from Gemtesa. There are so many tools that are now available to really help you and your patient, your man with BPH, overactive bladder, urgency incontinence, to really encourage them to take off their armor of masculinity, lower their defenses, and really engage and embrace these management strategies that we have now, like beta-3 agonists, Gemtesa. They have tools where they can hear stories of other men going through the similar experience of overactive bladder and urgency incontinence. They have starter kits. They have the ability for men to stay on track. So talk to them, the team at Gemtesa, to find what tools are available that you can use to really optimize their experience. So let us work together. Let's prioritize helping men live the best version of their lives. And we can do that together.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to Vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see full prescribing information.